Welcome to the We Win in... Whoa. That wasn't a great start.
Did you hiccup in the middle of the intro?
I don't know. Maybe I had a little coffee or something. I don't know.
We're already winning.
Yeah. Welcome to the We Win Injury Law podcast. Is that better?
It's awesome.
That was good.
Nailed?
Nothing.
Welcome, everybody. I'm Tyler Todd, your host, sitting here with my co-host, Jaren, the Snow Canyon man, Sandberg. And we have a special guest today, Dr. Steve Baum. Dr. Baum, right? I said that right?
You did. You nailed it.
Perfect. Well, I didn't nail my intro very good, so so I had to make sure.
2 for 3.
Yeah.
2 for 3 is okay. Hey,
I
look,
wasn't gonna say that.
2 for 3. 2 for
make
3
them
is
look
like
good, right?
is like Hall of Fame numbers,
Yeah.
you know. So
It's true. If you're batting 66, you're doing good.
you're doing
So,
pretty good. But welcome to the show. We're glad to have you.
Yeah, thank you.
And you're. I want to ask you a few questions about you. I don't know. I know you a little bit because I follow you on social media,
For
which
sure.
has been awesome. Doctor,
Yeah, MD.
MD?
medical Doctor, yeah.
where did you go to school?
So started at the University of Utah, where I majored in exercise physiology, and then the Ohio State University.
Okay. Yeah, I did see
College of
that.
football, right? So yeah, that's where I went for med school. Yeah.
What made you choose like Ohio State other than like, you know, I guess they're a decent program.
Yeah. So yeah, they're pretty
They're
good
okay.
program.
They're decent. Yeah.
So interestingly enough, they have a good pipeline. Like they like Utah students for whatever reason. So when you look at like I was in on the admissions committee for a couple months, and they had an even ratio. Like our class, they took 7 from BYU and 7 from Notre Dame. They didn't want to
Oh, no
play
kidding. They didn't wanna,
favoritism between Mormon and
Really?
Catholics, right? So that was even. And then there was a few of us from the University of Utah, but yeah, traditionally they like well-rounded. You know, for the most part, people coming from Utah have a little bit more life experience than your typical
Okay.
college student, whatnot, been on a mission, military, families
Sure,
type of
sure.
stuff. So yeah.
Wow. So let's back up then a little bit. Before, so you did your undergrad at University of Utah.
Yep.
And you bleed red or you bleed Ohio State? Ohio State.
Yeah. So yeah, to be honest, I didn't go to a single college football game until I got into med school.
Really?
It's a whole culture there.
Yeah.
You're immersed in it. You can't help it.
So you're a Buckeye through and
I'm a
through.
Buckeye through and through for sure.
And then the family also.
Family cheers for Ohio State
Yeah.
when they don't cheer for their primary teams. Yeah.
Awesome. Okay.
Yeah.
Just making sure the priorities are right.
Yeah.
Well, you know that your degree is only as good as the sports team for that school. You know,
Exactly.
that's-
Right. And so that's why my degree is pretty much crushing it. Right?
Yeah, I mean, that's
That was
it's a
me
top
with-
one. It's a
I went-
top one, that's
yeah.
for sure.
I went to Gonzaga, and I remember a law school professor basically saying, like, the better we do in sports, the better people will think your law degree
Yeah.
is. I'm like,
That's-
okay,
that's-
To
let's
some
go.
degree, it's accurate. I mean, it's not wrong.
Let's go.
To some degree.
I wish I knew my sports a little better than this. But is Indiana in this? Are they big?
They are. They're in our.
They're in your
Big Ten,
conference,
in our
right?
Conference.
Yeah.
This is the first time.
How do you feel about that?
It's great. I mean, honestly, it's not great, right? I don't want to see our team lose. I mean, we lost by 3 points.
Yeah, yeah.
In conference. So I mean, we did better than any other team that played against them.
True.
But think about it. I mean, Indiana, they don't have half the budget that these teams that
Right.
just went out and freaking crushed, right? They don't. And so for them to pull that off, it's absolutely amazing.
It was pretty cool
I
to
think
see.
It brings a spark back to college.
Now, one thing I wonder, and we'll get into some other things before, but we get this little tangent. I like it. I just thought about it. Kurt Signetti, right? The Indiana coach is like, I win everywhere. Google me.
Yeah.
In fact, a lot of our billboards now are like, we win, just Google us based on him.
Yeah.
Will he win without Mendoza?
Yeah, probably not.
Yes, I mean that's why I'm like,
That's the hard part.
Heisman quarterback makes a pretty big difference.
it makes a big deal. That's what I'm thinking too. I'm like, I wonder how he's going to do post Mendoza.
Yeah.
But we'll see.
Anything's possible.
Yeah.
I'm sure he'll have a good run, but I don't think he'll be as formidable.
I can't imagine. Well, if Ohio State has anything to do or say about it,
Yeah.
probably not. So let's back up a little bit. Before then, the U for undergrad. Did you go on a mission or have any military experience, or what's your background?
Yeah, so I served LDS mission in Mesa, Arizona. Didn't speak Spanish. All my companions were Spanish speaking, so we were always called the Zebra Companionship.
Okay.
One white, one brown.
Right.
A lot of fun with those guys. And then after my mission, I joined the Air Force as a TACP, or a tactical air controller. So that's part of their special operations units. We called in airstrikes for the Army. So I deployed, stationed, trained. Everything I did was with the Army, which sucked because part of the reason I went to the Air Force because I wanted nicer bases, right?
Yeah. That's
Higher
what they say,
living,
right?
Yeah, and then I got stuck, being stationed on Army bases. So
No.
yeah, I was like a redheaded stepchild of the Air Force.
Right,
But,
right.
I got to do some cool stuff.
Did all the guys on base resent you then because you're with the Air Force? Was that kind of the vibe?
Right, yeah, exactly.
They're
yeah.
like,
So
oh,
it's
this guy.
Yeah. So yeah, it was just whatever.
All the branches seem like they razz each other pretty good. So I'm sure
they
that's
do.
part of
Yeah, I
it.
was like, what's the chair force doing here? We'd go train with Marines or go train with the Army or whatever, and it's like, whatever,
Right.
I'll show you what I'm doing here. If you really want me to, I was just smart enough to get into the Air Force, and then
That's
after all jokes aside, they'd be like, okay, yeah, but seriously, I didn't pass, I didn't get high enough on the ASVAB, so I couldn't get in the Air Force, couldn't get in the
Like, we
Navy,
wish we were actually doing what you're doing.
Yeah, exactly. It's like, yeah. Whatever.
What branch was your dad with? Was it?
My dad was Navy. My dad was Navy, and then my brother was Navy. But my grandfathers were Air Force.
Cool.
Both my grandfathers were pilots in the Air Force in World War II. One was shot down. It's kind of weird. My family, we have a Pearl Harbor story.
Okay.
So my grandmother was married to a man, Theo Sparks, shot down over the Pacific, and then one of his wingmen, like legit Pearl Harbor, came home, and my mom's oldest sister had been born, and so then my grandfather came home, married my grandmother,
Okay.
Who now a widow from the
who is now a widow.
from his.
One, she's passed away, but it was just totally Pearl Harbor. Now, of course, the first one didn't come back and be like, here I am. And there was nothing like that.
Yeah.
But but both of
He's talking about the movie.
the movie. Sorry, both my grandfathers, I guess, on that side, I kind of consider them like both grandfathers were pilots over the Pacific, and then my grandfather on the Todd side was a bomber over Tokyo.
Okay. Cool.
So Air Force in my family for sure.
Yeah. Awesome.
And both my grandfathers, biological grandfathers, are buried in Arlington.
Okay.
So yeah, kind of cool.
That is cool.
Arlington Cemetery.
Yeah.
So when I go into Arlington, then I'm like, hey, I'm here to see my grandfathers. And,
Yeah, absolutely.
And they kind of take you on the private side, and they take you up to like their grave sites, and it's really cool. So much respect for military service, and thank you for your service.
Cool. Right on.
How long were you in?
2 years.
2 years.
Yeah. Year training, year deployed, and then I got my associates in information systems technology, and then got out with my GI Bill and
Awesome.
went my way.
And then after the military, went to Ohio State.
Well, I went to university. I went to University of Utah.
Okay.
That's with my GI Bill, and I was actually my best friend. We grew up near Tacoma, Washington, near Seattle.
Oh, really?
And he had been SWAT, while I was out doing all the things I was doing. I was like, well, I know how to do, this kind of stuff. I'll just go join him, start, kicking doors and whatever. And then I was like, well, I guess I got my GI Bill. I should go to college. And
Right.
started that route. And then it was just like one thing turned in the other. Before I knew it, I was in med school. So, yeah.
Good for you. So where'd you go to high school?
Rogers in Puyallup, Washington.
Puyallup. Okay. Yeah, we played Puyallup.
Okay.
I graduated from Central Kitsap.
Okay.
Yeah.
Oh, you're from Washington?
So, I mean, my dad military.
Yeah.
Was on Banger. Is it Banger Naval Base?
I don't know
there in
the Navy
Bremerton.
bases. Okay, Bremerton, yeah.
So yeah, I lived in Silverdale for 2 years.
Cool.
So I graduated from Central Kitsap.
Okay.
So yeah, no, I know Puyallup
Yeah.
and all that area, Tacoma.
Yeah.
When you said Tacoma, I was like, wait,
Yeah.
I know Tacoma.
Yeah, you do. That's awesome.
Played basketball, Gig Harbor, and all over.
Okay.
And
That's where my buddy lives now, is in Gig Harbor.
Gig Harbor? Yeah.
We go visit him about once a year.
Oh, it's beautiful.
Yeah, it's crazy beautiful, right? It's like, what the heck?
we went last summer, 2 summers ago, showed the family, showed my high school, all the things. Yeah. So it was awesome.
Yeah.
It's a beautiful place.
That's cool.
So then how'd you get to University of Utah then from Washington?
I think I drove at the time.
Okay.
Yeah, I think I drove, and I just ended up coming with a buddy. I was actually living in Portland, Oregon, where my grandparents were. So my family's not LDS.
Okay.
My grandparents are. So it's like the three of us I got baptized when I was 14. Didn't grow up in the church or anything like that. But so after high school, I moved away to live with them for a year to prepare for my mission, kind of get away from all the knuckleheaded,
Sure.
things that high school comes with sometimes. And anyway, so that's where I was living. And yeah, a buddy that I had, made friends there before my mission. When I got back, he's like, oh, I'm going to Utah. I was like, that sounds cool. And so just kind of followed him out there.
And then the rest is history.
And then when I joined the Air Force, I was living in Utah. So while I was away, I became a Utah State resident, and I didn't know it because that's where I was recruited from. So when I got back, my GI Bill covered in-state tuition.
Gotcha.
So this is by default where I had to go to school.
Oh,
No kidding.
Yeah. So I started applying to schools and, back home and whatever, and it was like, oh, that tuition actually isn't going to be covered by GI Bill.
Right.
So,
Right.
I didn't know that you had to do it in state from where you were at.
That's
with
kind of
that, but-
fascinating.
Yeah, you become wherever you're recruited from.
Well, the
becomes your
story,
in-state.
that story,
Yeah, that
like
makes
your
sense, especially if
story.
You're deployed. 'Cause
Yeah.
They can't count it as well. I'm from wherever
Yeah,
you're deployed to.
I'm an Iraqi citizen
Yeah.
now. Like, yeah.
Yeah. So it
And
makes
go to
sense.
school there, but
I never, like I said, I never thought about where you
Yeah.
ended up having to do it. So that's,
You may
that's
not have
interesting.
made it to Ohio State.
yeah.
Yeah.
Yeah,
From there.
yeah, exactly. So
Well, that's really cool though. I love talking to people like you, and when we talk with clients, it's fascinating to hear stories about what their path and what their journey was,
Sure.
right? And then into medicine, of course, and our path into legal. We could talk hours about it, but. So, what is your primary focus now? So you're MD. What
Yeah.
is your practice now?
yeah, that's such a good question. Yeah, so I'm board certified in family and obesity medicine. So I hold 2 board certifications. I had a rural medicine scholarship obligation to fulfill after residency, so I spent a couple years in Casper, Wyoming, and a year in a suburb of Phoenix, Wickenburg. It's a pretty small
I know Wickenburg.
Okay,
yeah.
yeah,
Clients from Wickenburg.
Okay, there you go. So yeah, small area. But anyways, yeah, so I was doing, family, community health out there. And then the past year actually was this will line up well for this podcast. I was in occupational health. So I spent a lot of time working with people with work-related injuries.
Gotcha,
illnesses,
yeah.
And on that side of things. And then I just, I don't really like corporate medicine, and I'm not going to get into that. But
Yeah,
there's
yeah.
the whole thing. And then I had kind of built up this side practice, this telemedicine side practice along the way the past few years that just grew word of mouth until it became a thing where I was making more money doing that on the side than I was my full-time job working for someone else. So yeah, so I left corporate medicine, and now my primary focus is in metabolic health. So I like helping people, lose weight, maintain weight loss, prevention, lifestyle medicine. But I think the best way to say it is I'm a concierge functional medicine doctor. So my patients have cell phone access. They just text me anytime they need something, need a phone call. They don't have to have formal appointments. And my job is just to make sure that they're functioning,
Yeah.
the best that they can.
Awesome.
Gone are the days where the doctor, brought his handbag and came to your house. Now it's use your cell phone.
Cell phone, yeah.
I like that.
Yeah, I don't even really have a handbag. So.
Yeah. No, but that's you think of like the old movies and stuff with the
Yeah.
doctor come to your house, right?
Sure.
Brought a bag full of tricks, and now it's you got everything at your phone, and you can.
Comes out of the room and
Yeah.
Dr.
tells
Steve, you got to
people.
realize that Jaren's still really old school.
Yeah,
Like,
yeah,
he's got an old soul,
that's cool.
Old
He still sees his handbag coming along. Like,
No, it's like you see old movies. Doctor shows up, and
Yeah, like the westerns, right?
yeah.
They still had guns on their hips too.
Yeah.
Spurs on their boots.
It was only a few years ago. He was still doing that.
Yeah.
Like, hey, put the holster away. Like, come on.
the doctor's here. Put the gun away. No, but I think it's great that you think of the technology but still going away from the corporate, because corporate medicine is what we're all used to.
Yeah.
We're all used to that.
Yeah, and there's just a lot of constraints. You can't practice medicine within corporate constraints, and insurance dictates things, and patients don't like it. And since you're the face, that they associate
Yeah.
their care with, and you're the problem essentially, and it just
Well, I want to ask you that because, when you say I want to get away from corporate medicine and all the different constraints and restrictions that insurances put on medicine, that's something obviously we see in our world, right?
Yeah.
Insurance dictating. There's ICP codes. Did I say that right?
ICD.
ICD codes.
Yeah.
All these codes, all these different things that doctors can or can't do to treat accident victims, and they do it in a way because obviously insurance dictates how they get paid.
Yep.
And so is that kind of what you were like referring to? Like, hey, I feel like this is what's really needed for this particular patient of mine.
Yep.
And
insurance says no. How
Yeah.
about, did you think about trying, XYZ first for several months? It's like, of course I did. I have the medical license, right? You
Right.
don't.
You right.
Let me do what I want to. What are you
Right.
talking about, right? So yeah.
And many
it's-
times it's claims adjusters, right? And I'm
Exactly.
not saying claims adjusters aren't smart. I have a sister-in-law who's a claims adjuster. She's brilliant, amazing, but
Evil, but yeah.
evil.
Come on.
Yeah, no soul.
No soul.
But smart she is.
Yeah.
But not medically trained.
Right.
And I think she'll acknowledge that.
Right. Well, and from an adjuster standpoint, what's their job, right?
Right.
To protect the company that they're working for. I mean,
Sure.
right?
Sure.
I mean, they-
Yeah.
So whatever we got to do to not pay, or pay as little as we have to, that's what they're trying to do, and that just makes things really frustrating to practice medicine.
1,000%. And even with, in our world too, because we we're not medically trained,
Sure.
but we've seen it similar to, I guess, adjusters, right? So we have a general knowledge of how we think it should go, but we don't really know. What's an ideal patient for you?
An ideal patient?
Yeah.
Honestly, someone that just is motivated to get healthy or to live a healthy life. So I have all kinds. I have people that come to me, they're like, I'm stuck where I'm at and I want help. I've started doing, X, Y, Z, but I need more help to get there. I'm like, sweet, you've got the motivation. Or people that are like, hey, I'm doing good. I could probably do better. And I want to make sure I'm doing everything I can to stay on track. So yeah, self-motivated individuals are fun to work with. That's one thing you see in traditional healthcare a lot, especially community health, is people keep coming to you, but they're never doing anything, that you recommend or give advice on. And it's kind of like, well, what are we doing here?
Right.
I can't help you.
Scratching heads.
Yeah, exactly. So yeah.
Do you treat clients mostly in Southern Utah, or are they kind of all over at this point?
That's a great question. So I'm licensed in 10 states. So from Washington State all the way to Florida and in between. And that's something I did, like I said, in the last few years, just kind of randomly. And so, yeah, I've got about 1,000 patients spread out over across the country.
Awesome. Yeah. So then some of the things that you can do is to like telemedicine type of things or treatment plans.
Yeah. So that's one thing.
You can use me an example if you want.
Okay.
If you're worried about if that's helpful.
I see what you're saying. It's like as far as like, yeah.
HIPAA or
Yeah,
something.
but yeah. I have
that's good.
permission. Yeah, so like, you remember COVID in 2020 and then nobody could go see their doctor in person, right? And it was like at that point we were kind of realized like, you know what? 80 to maybe even 90% of what I do in clinic does not require me to see someone in person.
Right.
To put my hands on them or et cetera. So that was like, so telemedicine really started from there and then it stayed because of how convenient it is, but also because of how practical it is. So your question was what kind of, things do I do, right?
Yeah.
I mean, basically anything. Someone, calls me, for example, Smith Parker, hey, I need some labs done. I want to get a look at, how I'm doing hormonally, so to speak. And then, we get the labs, go over the results, and then come up with the treatment plan. I mean, you do that in clinic, just the same.
Right.
So, yeah, I mean, pretty much anything that doesn't require me to put my hands on you, do a procedure, cut something out,
Sure.
It can really be done. From a telemedicine standpoint.
The technology is pretty awesome. I mean, we're in that same day and age, I think, with legal. Many of our clients we've never met personally. I mean, face to face, like in person. We've had phone calls with them. We've had Zoom meetings with them or whatever. But yeah, fortunately for us, we don't. Nothing that we do ever requires to touch
someone. Yeah.
Touch anyone.
Could be a lawsuit, right?
Especially if we want to punch a defense adjuster or something. We just can't. That's frowned upon in the law.
There's been some opposing counsels that are like, if you were here in person, but yeah, we don't have to do that. We don't have to do that, obviously. So
we try never to touch our clients.
But I think people are more comfortable with it, and probably in the medical field, just like the legal field, that people are more comfortable with it. Yeah, it's timing. It's convenience, which is awesome. Accident victims, because that's who we deal with.
Sure.
Patients, clients. How soon should they see you? I mean, that's a big question. And in fact, I just had literally Sunday. This is 2 days ago. What's the first doctor I should see? That was the question to me.
Yeah.
Should I see the chiropractor? Should I see my primary doctor? Should I see a physical therapist? Like, what would you recommend for people that have just been involved in an accident? Like, what do they do?
Absolutely. So typically timing wise, like, you always want to be seen as soon as possible. Okay. If you're not dying, I don't think it's a matter of going to the ER type as soon as possible. Right. Urgent cares are very good places to start because they're quick to get into, and you want documentation ASAP, right? This is what happened. This is what I was experiencing. These were my symptoms. This is what was done in terms of diagnostics, imaging labs, whatever. Have that on paper as soon as possible. That's very important. So yeah, I think urgent care is great if you can't get in with your primary care doctor within, 24, 48 hours tops. And that's where I would start. Because most places like physical therapy will require a referral of some sort, right? And so that's where you're going to get that from a primary care doctor that can say, yep, I'm going to send you. And yeah, physical therapy for sure. I'm sure we'll get into this. is, probably one of the best places people can go, post injury, post accident. But yeah, definitely need a referral first.
Why is a referral needed? I don't understand that.
Insurance games,
Yeah.
right? So
Okay.
yeah. So in order for physical therapists to get paid,
They have
need
to have that direct
a
referral.
doctor that says they need.
I've always
the
been
service.
curious about that because we we'll have a client that goes and gets their own MRI, clearly have a torn shoulder.
Yep.
They're trying to call, even our local orthopedic offices, and they're like, "Who's referring?"
Just hold the mic. Sorry.
Anyways, they're just go after them like, "Sorry, we can't see you. You need to
need a
go see
referral."
someone else."
Yeah.
And so then we're like looking up a nurse practitioner, someone that can get them in quickly.
Yeah.
Because sometimes they'll be like, "Well, my primary care physician can't see me for a month and a half."
Yeah. And that happens, and that's where I'm saying, like, yeah, go in the urgent care, as soon as possible, which stinks because, well, they might be doing that now. It used to be a thing where urgent care wouldn't give
Right,
referrals,
right.
but I think they are now.
They will now,
especially at
yeah.
Intermountain. Yeah, don't quote me on that, but I'm pretty
But
sure.
they'll
that's a
refer
thing.
out to like either a specialist or
Yeah.
back to like
Yeah,
physical
exactly.
therapy or to
yeah,
whatever.
I'm pretty sure they can get that now because of how long it can take to get into primary care, especially down here
Right.
in southern Utah. So
It's kind of wild.
yeah.
I had thought of a question as you said it, and I've never really thought about it, and so I'm curious your input on it. Can blood work or lab work or whatever you're doing with labs? I mean, I'm presuming blood work. Can that show a picture of injury or trauma to individuals post accident?
Sure. Yeah. So, depending on the type of injury. So, for example, like a crush injury to muscles, it can raise levels of something called creatine kinase, which is an enzyme found in muscles and released particularly in injury or, really, really hard workouts.
Yeah.
So, yeah, for sure that could, and then subsequently that can cause kidney damage, which can raise creatinine levels. So, yeah, there's definitely, evidence, inflammation, CRP, ESR, things like that.
Can that be shown in labs?
Mm-hmm.
Really?
Yeah.
Huh. See, learn
Makes-
something new every day.
I was gonna say, it makes you want to think like we're just wheels are always turning. Like, could we get labs? Because one of the things you always worry about with soft tissue injuries is they don't show up on like an MRI or they won't show up on a CT scan.
Yeah, significant ones like you talking
Yeah,
about, tears or
Tears,
ruptures or whatever. But things that cause pain,
yeah.
don't always show up on imaging.
Right.
Absolutely.
Yeah. I mean, and then of course we hear it all the time from the adjusters. Well, objectively, it's just a soft tissue injury. And I'm like,
Yeah.
objectively, you can shove it up your, but
yeah,
that's
Yeah.
that.
Well, that
but-
would be subjectively. Subjectively,
yeah. Subjectively and objectively, I will shove it up your whatever. Both.
Both. That's coming from me and my client.
But that's a super interesting thought that honestly, like, okay, everybody watching, right? Get to your doctor immediately. And we've been kind of like anti-primary because, well, one, I don't know how many primaries are actually taking labs. Maybe, I don't know. But for accident patients, victims, clients of ours, we've always been like, okay, see chiropractic or PT. Chiropractic's kind of the first step. But it also makes sense to see you and then do lab work and do some other things, maybe in conjunction with those other modalities or practice areas for ultimate like wellness. I mean, that, how do you, what's your thoughts on working with other practice areas or doctors or providers in that like realm, if you will? Does it make sense to do that or?
Yeah, I mean, that's what we did, right?
Yeah.
In occupational health, that is what we did.
Right.
We get hurt on the job. And sometimes that would mean being involved in a motor vehicle accident, right? They were driving a work truck and got slammed or whatever, and they come see us, and it's our job to gather data, get as much objective evidence as possible, whether that's imaging or labs or whatnot, and then make the specific referrals, for further assessments. So one time, one thing we always ran into is, I have a really strong clinical suspicion this guy has a completely torn rotator cuff. He can't raise his arm.
Right.
I don't know what else. I don't really need an MRI, to diagnose this. But, of course, insurance is just going to say, well, I'm going to do physical therapy, for a few weeks, and then we'll authorize the MRI. And it's like, go to physical therapy. I can't do anything with this guy. He can't raise his arm. I know, right? So I guess keep seeing him and keep writing he can't raise his arm for another 4 weeks, and we'll get the MRI. So, yeah, I think it's good. I think the problem is though, before I actually did occupational medicine, I had no formal training, as a family medicine doc in the realm of occupational health or accidents or injuries or things like that. So it's more than just the medicine because you're worrying about the legal aspects, things, you're documenting specific things for the purposes of, legal documentation, so to speak. And we don't get that kind of, training in med school or just your typical residency. So yeah, it's that would be the tough thing about working with primary care doc, is just most of us aren't trained like that.
Right.
Yeah, and that's always been our kind of why we're skeptical of it is, we'd have a client that a chiropractor or even a physical therapist would recommend a lot of treatment, but their primary care doctor was like, here's a expensive dose of ibuprofen,
Right.
800 milligram version that you can get. So you only have to take one pill instead of four.
Yeah.
And it felt like, and then the insurance company latches on to that primary care physicians. Well, they didn't recommend this, and you're like, well,
They didn't even report MBA.
Yeah.
And you're like, that's why they went.
Right.
Yeah.
Or sometimes they'll document like all of the the exam at a lot of those places was they checked their weight, they maybe asked them a few questions, and then it was normally a sit down. And if the patient's not great at like articulating how hurt they are and where, it ends up being like a 10-minute visit. But then their record, like, it's a lot of forms and form templates, says they did a full physical exam and there was no findings, no injuries. And you're like, well, that's not, they obviously then did, $12,000 worth of billing
Right.
over the next 3 to 6 months. Clearly something was going on, but
Right.
you look at that primary care physician visit and,
That
so we've
kinda
always
sets the
been,
tone.
we've
does
always
to
been
some degree.
skeptical to that.
Well, and yeah, you have the MD, which is obviously well earned, and so then they take a little bit more weight from the MD perspective versus all the different other modalities, and they kind of put a little bit more weight on that.
Yeah.
And so, right or wrong, I don't know, but yeah, it does set the tone. So in our world, documentation and record, it's so vital. We've had a number of clients even with surgical consults. You're directly related to the 4-car rollover, and she's in a neck brace, and then she goes to the the orthopedic to get a back surgery consult, and there's no mention of the car accident. And it says I think it said chronic pain on the record, and I'm like, what are you talking about, chronic pain?
Yeah.
Maybe chronic since the day of the accident to right now.
Right.
But this is not some degenerative issue. This is an acute trauma that happened from this accident, broke her neck, and now we're having a surgical consult, and you guys put chronic pain.
Well, and anytime you put something like that, you always, at least the way I was trained, what started, right? Chronic pain secondary to what?
Right.
Right. So if they're just putting chronic pain, patient just has pain. Well, that's poor documentation, right? Like what did they have pain for?
It wasn't
When did
great.
it start,
Right. So I had to call their office and say, look, you're essentially killing this case.
Yeah.
And not that it matters in regards to killing the case, but it's just not accurate.
Sure.
It doesn't read accurate. And it may be inconsequential to you and your record keeping within your office, but it's super consequential to the client and all the subsequent care she's going to need.
Yeah.
So I just think, and maybe it is a medical school issue, right? They're just not doing the training. We get that all the time, right? At law school, we don't get trained on half the stuff we do.
Right.
Do we get trained on how to take the bar exam? Sure.
Yeah.
But how to be practitioners? Not really. So, okay. So I think the lab work thing is brilliant. I feel like that's something that, honestly, it's like a light bulb moment today with like doing more lab work to show soft tissue injuries and other things. What else? So timing is important. And then what else would you recommend to accident patients that you see? First, get in here sooner than later.
Mm-hmm.
And then what about keeping appointments and visits and that type of thing? Is that, I would think it's important. What's your thoughts on that?
Yeah, because a lot of people mistakenly think, I'm hurt, so I can't move, I need to rest. And that's like the exact opposite of what your body needs. Most people don't realize that, a sedentary lifestyle in general, not exercising, leads to low-grade inflammation in the body and accounts for up to 80% of chronic disability worldwide.
Wow.
So you put a sedentary lifestyle next to smoking and poor diet. Those are the 3 top causes of disease in the whole world. So take someone who now has just a fresh injury, increased inflammation, and you're going to add more sedentary, sitting back, not doing anything on top of that, and you just get more and more problems. So I think the idea of repetitive visits not only can monitor progress, but also hold patients accountable, right? Like keep them on track. Because people are a little more motivated. Oh, crap, I got a doctor's appointment next week, and he told me I needed to be doing some, light range of motion, whatever. He's going to ask me about it. I want to be able to tell them I'm actually doing it. So I
Right.
guess I'll start, doing it type of thing. Whereas it's like, oh, I'll see you in 6 months. You just kind of forget about it.
They're cooked afterwards.
Forget about it. Yeah.
Yeah. Well, and that's another point that I've had. So two things that pop in my mind as I'm listening to your answer. I feel like sometimes the repetitive like visits our clients kind of get dinged for it.
Mm-hmm.
Like they went 3 times and almost to some degree, just the very act of going is beneficial,
Sure.
right? In addition to obviously everything you're doing, like with whatever treatment you're providing in the visit, but just the act of going is beneficial because it
Getting
gets them
up and moving.
Yeah, it gets them
absolutely.
moving.
You bet.
Yeah, it gets them. They have to like walk. They have to, or at least somehow move to get to
Circulation,
the visit.
Yeah.
So that helps promote healing and wellness. And then we've been learning a lot about concussions. Concussions are a big deal in our world too,
Sure.
with MTBIs or moderate TBIs, severe TBIs, traumatic brain injuries, and of course, and you can speak to this, but I understand like the old way of thinking was, put them in a black dark room, don't move,
Mm-hmm.
and now it's like active rehab.
Yeah.
Do you have thoughts on like TBIs and what you see in regards to like concussions or brain injuries?
Yeah, 100%. Yeah. So this is one thing, believe it or not, we dealt a lot with in my year of occupational health with teachers. For whatever
Teachers?
reason, teachers are always falling over.
Oh, wow, okay.
I don't know, slipping on wet
like
floors.
out of
Jared,
Yeah.
Jared's always doing this. Jared's like, oh.
Yeah, no, really though, like falling over, slipping on
kid
wet
just
floors, standing on chairs to hang a poster, for PTA meeting, and falling down, or unruly students, getting hit in the head. PE teachers, whatever.
If
Yeah,
I
it
was
was
around
like
kids long enough, I think I might be like,
Get a concussion
no,
too.
I
Yeah.
fell off the ladder.
You're like, I gotta take a break.
Yeah. So, and like you said, a concussion is a TBI or a traumatic brain injury, but it doesn't show up like on a CT or MRI, right? There's not gonna be any physical changes or pathology on an MRI. So the diagnosis is what was the mechanism of injury? Blunt force trauma or whiplash, like an MBA, and then B, what are the clinical symptoms? And you can match that up. And yes, you're absolutely right. No, we're not going to tell you to go sit home in a dark room for 2 weeks. We actually encourage you to get back to work tomorrow,
Right.
but with modified duties. For one, stay away from whoever just hit you in the head type of thing, right?
Jared.
Don't go play dodgeball.
No more dodgeball.
No
for
more
you for a
dodgeball
little
with those
bit,
big red rubber balls.
Yeah, exactly. And then just increase activity as tolerated. That was one of the thing we say. So it's like screen time. Don't do it as much. As soon as you start to feel any sort of symptom, whether that's headache, nausea, blurry vision, irritability, whatever, back off from whatever you're doing. And employers are always willing to work with people like that. But yeah, back to your point, early engagement, early activity, getting back into things, whether that's just at a lighter pace, is absolutely essential to the recovery process.
A lot of times adjusters will kind of like push back on the lack of care post concussion, right? Because there's not, and maybe speak to this, there's not much you can do. What is done like post concussion diagnosis? Is there?
Yeah. So really it's, you start with modified activities, right? Don't do anything that makes your symptoms worse. It's, statistically speaking, like 50 to 80% Americans are dehydrated, on any given day. We just don't drink enough water. Injuries, particularly brain injuries, they need water. So you really have to push hydration. Omega-3 fatty acids have been shown in some studies to promote the recovery, quick
Gotcha.
recovery. So we'll push those supplements. And then it's, blood flow. It's got to get circulation. So it is just light walking, range of motion type of thing. And then we monitor, a lot of times people come back in a week and then 2 weeks and things steadily are getting better. Or if they're not, there are concussion specialists like neuropsychiatrists that work specifically with these types of things to help people get better, and then that's where they would go. I would say the majority of my patients that I saw in occupational health would get better on their own without any sort of special treatment other than what we needed to recommend. But sometimes they needed physical therapy and or that neuropsychiatrist to help them
Brilliant.
improve. So
Yeah. Are there, from the medical doctor perspective, are there concerns long term for those that suffer concussions or MTBIs, moderate or more severe TBIs? Are there long term concerns for the brain?
with repeated or repetitive injuries, right? Not so much, I think, with a single one. course, I can't, state the literature in terms of like what percentage of people with the first time TBI will result in, long-term symptoms that never get better. I don't think the percentage is super high, but I'm sure that also depends on the mechanism of injury.
Right. Right.
So like a teacher falling off a chair, probably not something that's going to lead to PTSD.
Right.
MBA though could seriously be something that lingers and causes distress down the road.
What about Jaren hitting her with a large rubber ball? Probably PTSD.
It depends on how hard he threw it.
You just think of those balls. We said the yellow ones too. Dude. Those red and yellow rubber balls.
I can just see like the ginger throwing the red
decking some teacher in the face.
Like that's PTSD. Like
it's one thing when they use those ones.
The ginger in
squish.
itself,
in of itself, right? I mean,
let alone holding a dangerous weapon.
No doubt. I could see you. You probably caused some concussions in your day.
Probably.
On what?
I had to fill Sydney in.
Oh.
She's so young. I was like, when they put you on those little wooden carts.
Oh, so you never did?
My balls.
Yeah.
Dodgeball, but like, I hated dodgeball, so I'd always leave.
Oh no, we had some.
By the time
dodgeball
I was in 6th
battles.
grade, they'd gotten like those squishy ones that
Yes.
kind of
Yeah.
that were a little softer. But like when you're in
man.
elementary school, it was like the most inflated rubber red ball, and you just deck kids with them.
That or
That was
like in high
dodgeball.
school, like in
Makes a lot of
Silverdale, we were playing like full on hockey, the street hockey, but
Yeah.
inside. And we were whacking. I mean, with those sticks, it was wild. I don't know.
That was me with
All-
roller hockey with rollerblades. That's what you did in Southern Utah. Is you just rollerblades.
No,
out
I
in the
know, but
parking
this was
lot.
like in high school.
No
This was like in
helmet.
PE.
None of us had helmets back then. Did you ever wear a helmet riding a bike?
No, I never.
I never. I mean, I went off jumps with a BMX bike. I did half pipe.
jumps.
But having said all of that,
Never-
wear your helmet.
never helmet.
Yeah, wear your helmet.
Yeah, wear your helmets. We're
Having
talking
said all
about
that-
I guess that maybe
TBIs.
that does explain a lot, actually. Where
Wear your helmets. I say that because one, you see crazy stuff. I mean, think about. I would have never thought teachers when you said that.
Yeah, me neither.
But that happens probably more than we can ever really imagine.
Yeah.
But I had a neighbor just fall off his ladder in the garage, and Lowe's. I think it was young 60s. I didn't know him very well. I know his wife a little bit, super sweet lady, but yeah, fell off his ladder. And my neighbor, a friend of mine, was coming down the street, saw him like laying on the ground in his garage, and started to administer CPR. And I think he thought it was like a heart attack.
Mm-hmm.
But I understand. I don't know this to be certain, but I understand he fell off the ladder and hit his head and killed him.
Wow.
Just
Just crazy,
Yeah.
right? Yeah.
and you just never know. I fell off my ladder.
I was like, I have a video of you.
I fell off my ladder.
Yeah.
Look at this little gem, right? I mean, putting up, fell off
Nice.
the roof of my house, and
laws of physics win every
fortunately,
time.
I bounced off like a cat and I didn't hit my head, and
Once I knew you were okay, that video was more fun to watch.
it's still a little cringy, but yeah, it's kind of funny. It's a funny video. It's a funny video. But yeah, and so but we argue all the time about like TBI, whether it's concussion of like early onset of dementia, Parkinson's, any sort of neurological like deficit issues that are becoming, I feel like, more and more prevalent, like in the United States for whatever reason.
Sure.
They're going to be obviously more subject to that. And can we say for certainty? No, but at least we argue it, you know, with the insurance companies. So, all right, lab work, TBI work, telemedicine for our, I want to say patients. We're not clients. Your patients.
Mm-hmm.
Recommendations. What would you say? Like, okay, involved in an accident. What's the first thing you do? And then, because I want to be able to say, hey, we talked to Dr. Steve.
Yeah.
He's legit. This is what you got to do.
Yeah.
Or even the thing that maybe they're not thinking of. That they've gone to their chiropractor, they've gone to their pre-CP, they're not getting a lot of relief. What's something that you think is that they're probably not doing? I mean,
Yeah.
I know you mentioned the hydration. That's probably something.
I love that.
I love that. I was actually thinking of that.
Yeah, so to kind of answer both questions, first thing, get evaluated as soon as possible. If you can't get into your PCP within a day or two, or 3, go to the urgent care. Just get stuff documented, get your, diagnostics done, get things taken care of that way. Once you, go see your PCP or whoever and you're on, treatment plan, you got to get moving, right? So 2 things, 3 things, 4 things, hydration, nutrition, sleep, and movement. Okay. People take these types of things for granted. We think of nutrition as, I eat. Well, you're eating calories. Calories don't equal nutrients. Nutrients are what get into your bloodstream to promote recovery, tissue healing, repair, things like that. So, okay, once you got the nutrients in the bloodstream, what's in the bloodstream? Water. That's why it's so important to be hydrated. If you're not hydrated, you don't got good flow, you don't get good volume. 3, if you're not moving, you also don't have good flow, good volume. So if you get the nutrients in there, they're just sitting there in the bloodstream. You got to be moving to get things delivered to those tissues that need that repair. And then sleep. Sleep is so underrated these days. You got to get at least 7 to 9 hours a night, without question, non-negotiable, especially when you're recovering from an injury. People that sleep on average less than 7 hours a night actually have an increased risk of premature death. It's like 12%. So
wow.
Yeah, sleep is very, very important. So, those are the basics that honestly I think people just don't think about. And when we talk about movement or, even exercise, I'm not saying you need to go to the gym and lift weights. You just got to move the body, go walk, get some resistance bands. If you're sitting there, just anything to get things going. And I really think physical therapy, chiropractics are great resources to help you not only, in person. They can do manual manipulation and things like that, but here's what I want you to do at home.
Yeah.
Oftentimes what you're doing at home is way more important than anything you're doing in clinic, in therapy. So yeah, those are the things that I think people take for granted. They're basic, but they really do add up and contribute to successful recovery.
It's great advice. I had someone who, a friend at the gym who he's like, you look at him, you're like, holy cow, like I need to look like you. So he's doing something right. And he told me just even walking for 20 minutes at night would be like a game changer.
For sure.
And at the moment I'm like, that's easy. I can do that. And I haven't done it once. I haven't done it once. Because I'm like, I think about it. I'm like, oh, that seems kind of hard right now.
Yeah.
No, I'm over it. I don't want to do that.
Yeah.
But yeah, just the simple act of moving sometimes is just, it would make such a big difference. So
It does. Yeah.
you've hit a lot of great things, and I'm super excited to talk with our clients about some of these things. It's really fascinating. Lab work is I'm so stoked on that. And so you may be getting a lot of referrals from our office. It's just because we're always looking for that objective, like, right? Smoking gun, here's the proof.
Yeah.
And I feel like this is, I've never heard it from any injury attorney around the country about how like lab work could be like so important initially to show so many things that are going on in the body.
Sure.
That are, are objective evidence of pain,
right?
Or inflammation or any issues that we're saying to insurance companies, look how bad it is. Right. So fascinating. Thank you for that. How can people find you?
How do people find me?
What's your website?
Yeah. What's your website? How do people reach out to you to say,
usually
hey,
at the
I need
gym,
Dr.
this
Steve in my life?
and go to the grocery store this time.
They're like, look.
Now how can a stalker find you? And
See me rolling, riding dirty. Yeah, so my website is the best place. It's got tons of information, all my contact info, and that's just www.kzn.health. So super easy to remember.
I was looking at your website and I
Did you like what you saw?
yeah, it's cool. But it was interesting to learn
he
about
was
kind of
stalking you.
why
He's like, where does he go grocery shopping?
I know how to find you.
Yeah.
I just don't know if anybody else.
Yeah.
No, it was Kaizen. Is that Kaizen?
Kaizen, yeah.
Kaizen.
Mm-hmm.
Well, you have a kind of a backstory why you chose Kaizen,
Yeah.
right?
Mm-hmm.
And I
Yeah.
think it's on your website. I read it.
Yeah. Yeah. So I got my master's in health administration last year, and during one of my business classes, we learned about the Japanese philosophy that Toyota adopted. Actually, I think it was like in the 80s, of continuous improvement. So their method was, hey guys, let's just make one small change every day of improvement that will build up to just this, great results. And they attribute that to, why they're so successful. But yeah, Kaizen, Japanese philosophy for continuous improvement. I thought that's a great thing that could be applied to health, and how I like to practice health in terms of lifestyle medicine and just changing everyday habits one small step at a time.
Cool. Yeah, no, I saw that and I like that. I appreciate it.
Cool.
That's why I asked you about it, because I read about it. I'm like, and when you just put your website, it reminded me that I read that. Yeah. So that's cool.
Right on.
And I need to do that. 20 minutes of walking. And I just, I need to take your advice.
Well, there's an ancient Chinese proverb: he who takes 1,000 steps after eating a meal will live a long and happy life.
Really?
Yeah. So, it's a
Dang,
thing,
I need
man.
to work on that. Yeah. So
1,000 steps.
yeah. So
Steps, yeah.
Kaizen and that's how you say it, right?
Yeah,
Kaizen.
yeah, just like that.
I just need to do it. So
Just need to do it.
appreciate it. I appreciate your insight. I appreciate you being here with us today.
It's good to be here. Appreciate you guys.
Yeah, like this is great stuff. I'm really excited for some of our clients because they just need to hear it. And sometimes we just don't, as we're lawyers, right? So we're the legal side, not the MD side, but I would expect a ton of referrals from our office. So I appreciate you being here and sharing some of your insights. You guys, honestly, there's just with TBIs, with injuries, and the games insurance companies play. So many times we get, and we'll wrap it up with this: do I need a lawyer to do this? And I think the simple answer is, without patting ourselves on the back, yes, because so many of these like games and tactics the insurance companies play for your own health and wellness, and like taking immediate action to start healing from that whatever injury you've been in or have suffered. And we can help you obviously get through that process, but also it's just knowing cool people like you to say, hey, this is where you got to go. This is what you got to do. Because ultimately we care about your well-being, number one. And then of course, number two, your case. That's what we care about. We want both to be successful, getting back to pre-accident condition and maximizing justice, which is what we do, and getting as much money for you because you deserve it. That's what we do. So until next time, everybody, stay safe, leave early, slow down, be kind and considerate to everyone around you. Like, subscribe, share, follow Dr. Steve. Where can they find you on Instagram? Are you on Instagram? TikTok?
Type Dr. Steve. What?
Just
It's
type
the Kaizen MD.
Kaizen MD.
Kaizen
So follow
MD.
on social media. Follow us on social media. We appreciate you guys. Until next time, everybody, stay classy.